Does the use of coping mechanisms in psychotherapy inadvertently reinforce the client's perception of threat that is basic to anxiety? This is a complex and controversial question that has been debated by psychotherapists and researchers for decades. There is no definitive answer, but rather different perspectives and arguments that can be considered. One perspective is that coping mechanisms are essential for helping clients manage their anxiety and reduce their distress in the short term. Coping mechanisms can be defined as cognitive or behavioral strategies that people use to deal with stressful or threatening situations. Some examples of coping mechanisms are relaxation techniques, positive self-talk, distraction, avoidance, problem-solving, seeking social support, etc. These strategies can help clients feel more in control, calm their physiological arousal, and cope with their negative emotions. Coping mechanisms can also facilitate the therapeutic process by creating a safe and trusting relationship between the client and the therapist, and by preparing the client for more challenging interventions such as exposure or cognitive restructuring. Another perspective is that coping mechanisms are counterproductive for treating anxiety in the long term. This perspective argues that coping mechanisms can inadvertently reinforce the client's perception of threat, which is basic to anxiety. By using coping mechanisms, the client may avoid confronting the source of their anxiety and never learn that it is not as dangerous or harmful as they think. Coping mechanisms can also prevent the client from experiencing corrective information that could challenge their maladaptive beliefs and assumptions about themselves, others, and the world. Coping mechanisms can also create a dependence on external or internal resources that may not always be available or effective. In this view, coping mechanisms can maintain or even worsen the client's anxiety over time. Therefore, the use of coping mechanisms in psychotherapy can have both positive and negative effects on the client's anxiety. The optimal approach may depend on several factors such as the type, severity, and duration of the client's anxiety, the nature and function of their coping mechanisms, their readiness and motivation for change, their therapeutic goals and preferences, etc. A possible solution is to use coping mechanisms flexibly and selectively, depending on the context and the stage of treatment. For example, coping mechanisms can be used initially to establish rapport and reduce distress, but gradually faded out as the client progresses to more exposure-based or cognitive-based interventions. Alternatively, coping mechanisms can be used as adjuncts or complements to other interventions, but not as substitutes or escapes. The therapist should also monitor and evaluate the effectiveness and side effects of coping mechanisms regularly and collaboratively with the client.